both groups, you are significantly more likely to stay sober if attending AA meetings. And then just to give you a brief crash course in pharmacology, one of the things that's often used to determine whether a drug is a dose-response curve, showing that if you take a higher dose of the drug, you get a better effect. So this is a dose-response curve for AA meetings, showing that the more AA meetings you go to, the more likely you are to stay sober. With, as you can see, the group of people over on the right who is lucky enough to go to more than 50 meetings in a 90-day period, which really isn't that many. Often people are advised to do one a day for the first 3 months, and they were much more likely to stay continuously sober, and the more meetings people went to, the more likely they were to stay sober. There's surgical treatment of addiction. We were talking about the different categories. This is obviously one of the more controversial ones in China. I believe they stopped doing this because it didn't go well in the end, but they tried destroying the nucleus accumbens in China and Russia, and they found that the people did not do much heroin, but they didn't do a lot of other stuff either. So it wasn't an ideal result. And then, there's obviously other surgeries for the end stages of cirrhosis. You can get a liver transplant, and again, Dr. Christensen had discussed the gastric bypass for eating disorders. Definitely an efficacious therapy for losing weight, but maybe not getting the underlying problem often. And then just to really discuss also that, again, detox is not the same as treatment. Just like for diabetes, you wouldn't give someone 1 week of insulin and then declare them cured and send them away. For hypertension, you wouldn't give someone treatment for 1 week and then after a week of normal blood pressure, you'll never have a stroke or heart attack. Like, it's a similar sort of thing here. Why bother to treat addiction? I believe that Dr. Christensen got this slide outside of his methadone clinic because of his very nice car. Actually, his car is not this nice, but someone had it. Just also to throw out, like, this is a disease that does not just affect the addict. So the theory of, those folks are bad, just let them get what they deserve, like, doesn't really hold up. Also, considering the number of families affected, I mean, something like 45% of